The rain hammered against the windows of the small clinic in downtown Seattle, creating a rhythmic soundtrack that seemed to match the chaos inside Sarah's mind. She sat in the waiting room, her fingers unconsciously tracing the scar that ran along her left forearm, a habit she'd developed over the past 3 years since returning from Afghanistan. The fluorescent lights overhead buzzed with an annoying persistence, reminding her of the field hospital where she'd spent countless nights patching up wounded soldiers. Sarah Chun had built her life around invisibility. After leaving the Army, she'd chosen to work as a night shift nurse at a small community clinic, deliberately avoiding the bustling trauma centers where questions might be asked about her unusual skill set. Her colleagues knew her as quiet, competent, and mysteriously skilled at handling emergency situations, but none of them knew about the 2 tours of duty she'd served as a combat medic with the 75th Ranger Regiment. Tonight was different, though. Tonight, the clinic was busier than usual due to a multi-car accident on the interstate. As Sarah moved through her rounds, checking on patients and updating charts, she noticed a new face among the medical staff. Dr. Marcus Rodriguez had arrived an hour earlier, called in from the nearby VA hospital to help with the overflow of patients. What caught Sarah's attention wasn't just his obvious competence or the way he seamlessly integrated into the chaotic environment. It was something about his movements, the way he carried himself, that triggered a recognition she couldn't quite place. Marcus moved with the precise, economical gestures of someone who had worked under fire. His hands were steady as he sutured wounds, his voice calm and commanding when giving instructions to the nursing staff. But it was his eyes that gave him away. They had that 1,000-yard stare that Sarah recognized in her own reflection, the look of someone who had seen too much and learned to compartmentalize in order to survive. As the night progressed, Sarah found herself working alongside Marcus on several cases. When a motorcycle accident victim came in with severe trauma to his leg, she watched as Marcus immediately began assessing for arterial damage with a thoroughness that went beyond standard emergency medicine protocol. His technique for applying pressure and controlling bleeding was textbook military, efficient, practiced, and executed with the kind of muscle memory that only came from repeated use in life-or-death situations. "You've got good instincts," Marcus commented quietly as they worked together to stabilize the patient. "Your pressure point technique is excellent, not something they usually teach in civilian nursing school." Sarah felt her heart skip a beat, but kept her voice steady. "I've had some additional emergency training," she replied vaguely, focusing intently on the 4 she was inserting. Marcus nodded, but she could feel his eyes on her, studying her movements with the same analytical precision she'd been applying to him. There was something unsettling about being observed by someone who clearly knew what to look for, someone who might recognize the telltale signs of military medical training that she'd worked so hard to disguise. The motorcycle victim was stabilized and transferred to the trauma center across town, leaving Sarah and Marcus to clean up and prepare for the next case. As they worked in the relative quiet of the treatment room, Sarah became acutely aware of Marcus's presence. He moved with the same controlled efficiency she'd learned to use in combat zones. No wasted motion. Every action deliberate and purposeful. "You know," Marcus said casually as he disposed of bloody gauze, "I spent 8 years as a Navy SEAL medic before I went to medical school. You develop a certain way of working when you're treating wounded soldiers under fire. It becomes instinctual." Sarah's hands stilled for a moment as she processed his words. He wasn't just making conversation. He was sharing information that most people kept private, information that immediately identified him as part of a very specific community. It felt like a test, or perhaps an invitation. "That must have been intense," she managed, keeping her tone neutral while her mind raced. Was he fishing for information about her background? Had he already figured out that her medical skills went beyond what any civilian nurse should possess? "It was," Marcus replied, his voice taking on a subtle weight. "But you learn things in that environment that stay with you forever. Ways of thinking, ways of moving, ways of responding to crisis situations that civilian medical training just can't replicate." Before Sarah could formulate a response, the emergency alarm sounded, signaling another incoming ambulance. They rushed to the receiving area, where paramedics were bringing in a construction worker who had fallen from scaffolding. As they transferred the patient to the treatment table, Sarah's training automatically kicked in. She began her assessment with the systematic approach she'd learned in combat zones, checking for spinal injury, assessing neurological function, looking for signs of internal bleeding with a precision that went far beyond her supposed skill level. Marcus worked beside her, but she could sense his attention split between the patient and her own actions. When the construction worker suddenly went into shock, Sarah's response was immediate and decisive. Without waiting for orders, she elevated his legs, started a second four-line, and began preparing medications for blood pressure support, all while maintaining the rapid-fire communication style she'd used when working with medics in field hospitals. Type and cross for 4 units, call surgery for possible internal bleeding, and give me a chest tube kit, she called out to the other nurses, her voice carrying the authority of someone accustomed to making life-or-death decisions quickly. It was only after the patient was stabilized and on his way to surgery that Sarah realized how much she'd revealed. The systematic assessment, the immediate recognition of shock symptoms, the way she'd taken charge of the situation, all of it pointed to experience that went far beyond civilian emergency nursing. Marcus was watching her with a knowing expression that made her stomach twist with anxiety. "That was impressive work," he said quietly. "Your response time and decision-making under pressure. It's exactly what I'd expect from someone with combat medical experience." Sarah felt heat rise in her cheeks, but she forced herself to maintain eye contact. "I've always been good in emergency situations," she said, hating how weak the explanation sounded. "I'm sure you have," Marcus replied, but his tone suggested he wasn't buying her deflection. "It's just that the way you handled that trauma assessment, the order of your checks, the way you positioned yourself for maximum efficiency, even the terminology you used, it's very specific to military medical protocols." The conversation was interrupted by another patient arrival, but as they went back to work, Sarah could feel the weight of Marcus's observation settling over her like a heavy blanket. For 3 years, she'd carefully constructed a civilian identity that allowed her to use her medical skills without drawing attention to their origins. She'd practiced civilian protocols, learned different terminology, and trained herself to suppress the automatic responses that had been drilled into her during her military service. But working alongside someone with similar training had exposed cracks in her carefully maintained facade. Marcus recognized something in her approach, because he'd been trained the same way, had developed the same instincts under similar circumstances. It was like trying to hide her accent from someone who had grown up in the same hometown. Nearly impossible once they started paying attention. As the night shift wound down, and the last patients were either treated and released or transferred to other facilities, Sarah found herself alone with Marcus in the break room. He was filling out paperwork while she restocked supply cabinets, both of them moving through their end-of-shift routines in comfortable silence. "You know," Marcus said suddenly, not looking up from his charts, "I've worked with a lot of combat medics over the years. Army, Navy, Air Force, we all learned similar techniques, but there are subtle differences in approach depending on which branch you served with and what kind of units you were attached to." Sarah's hand tightened on the box of gauze she was holding, but she didn't respond. Army medics who worked with special operations units. They develop a very specific skill set, Marcus continued, his voice casual but purposeful. They learn to work fast, work quiet, and make critical decisions without backup. They learn to assess trauma patterns that you don't typically see in civilian medicine. He finally looked up at her, his expression serious but not accusatory. "I'm not trying to pry into your personal business, but I recognize the way you work. And if you're who I think you are, if you've served in combat and you're trying to build a civilian life, then I want you to know that you don't have to hide it from everyone." Sarah set down the box of supplies and turned to face him fully. For a moment, they stood in silence, the weight of unspoken understanding hanging between them. She could see in his eyes the same mixture of pride and pain that she carried, The knowledge that they had served their country in ways that most people couldn't understand, and the struggle to find their place in a civilian world that often seemed foreign after military life. "I'm not ready to talk about it," she said finally, her voice barely above a whisper. Marcus nodded slowly. "I understand. But if you ever want to talk to someone who gets it, someone who knows what it's like to come back and try to figure out how to be normal again, I'm here." As Sarah drove home through the empty streets of Seattle, rain still pattering against her windshield, she found herself thinking about Marcus's offer. For 3 years, she'd carried the weight of her combat experiences alone, convinced that sharing them would only invite questions she wasn't ready to answer and judgments she couldn't handle. But tonight had shown her something she hadn't expected, that hiding her true self might be more exhausting than revealing it. Working alongside Marcus had felt natural in a way that her interactions with civilian colleagues never did. There had been an unspoken communication, a shared understanding of urgency and precision that she'd missed more than she'd realized. Still, the thought of opening up about her military service filled her with anxiety. Her combat experiences weren't just professional history. They were deeply personal trauma that she'd spent years learning to manage. The nightmares had finally started to fade, the hypervigilance was becoming more controllable, and she'd found a rhythm in her civilian life that felt sustainable. But she couldn't shake the memory of how it had felt to work with someone who understood her instincts, who recognized her skills for what they really were, and who didn't seem fazed by the intensity of her approach to emergency medicine. For the first time in years, she'd felt truly seen by a colleague. And while that was terrifying, it was also unexpectedly liberating. As she pulled into her apartment complex, Sarah made a decision that surprised her. Tomorrow night, when she returned to work, she wouldn't actively avoid Marcus the way she typically did with people who asked too many questions. She wasn't ready to share her story, but maybe she could start by accepting that someone else recognized it, and that recognition didn't have to be something to fear. The rain had stopped by the time she reached her apartment, and as she looked up at the clearing sky, Sarah allowed herself to consider the possibility that she might not have to carry her secrets alone forever. It was a small step towards something she couldn't yet define, but for the first time in 3 years, it felt like a step in the right direction. 3 weeks had passed since Sarah's first encounter with Marcus, and their working relationship had settled into a comfortable rhythm of professional respect and unspoken understanding. Marcus had been called in to cover several more shifts at the clinic, and each time they worked together, Sarah felt a little more at ease with his presence. He never pushed for information about her background, but his quiet acknowledgement of her skills created a space where she could work without constantly monitoring herself for signs that might give away her military training. Tonight felt different from the start. The clinic was unusually quiet for a Friday evening, with only a few minor cases coming through the emergency entrance. Sarah was restocking trauma supplies when she heard familiar voices in the hallway. Marcus was talking with Dr. Jennifer Walsh, the clinic's chief administrator, about expanding their emergency response capabilities. "We've been discussing the possibility of implementing a more robust trauma protocol, DR," Walsh was saying as they entered the supply room where Sarah was working. "With the increase in accident-related injuries we've been seeing, we need staff who can handle complex emergency situations." Marcus glanced at Sarah, who continued organizing bandages with deliberate focus. "Advanced trauma care requires specialized training," he said carefully. "Not everyone is comfortable working with severe injuries, and proper protocol implementation needs team members who understand both the medical and operational aspects of emergency response." Dr. Walsh nodded enthusiastically. "That's exactly why we're so fortunate to have you consulting with us. Your military medical background brings a level of expertise that's invaluable for this kind of program development." Sarah's hands stilled for a moment. She'd known that Marcus had mentioned his Navy SEAL background to the administration when he'd started consulting, but hearing it discussed so openly made her acutely aware of how carefully she'd hidden her own military service. While Marcus had used his background as a credential that enhanced his civilian career, She treated hers like a secret that could destroy the life she'd built. The key, Marcus continued, is having team members who can maintain clear thinking under extreme pressure. Military medics learn to compartmentalize trauma and focus on what can be controlled, but that mindset isn't easy to develop in civilian training environments. As they left the supply room, Sarah found herself thinking about the differences in how she and Marcus had approached their transitions to civilian life. He had embraced his military experience as part of his professional identity, while she had buried it so deeply that she sometimes felt like she was living as a completely different person. Later that evening, a call came in about a serious accident involving a teenage driver who had crashed into a tree. The paramedics arrived with a young woman who was conscious but showing signs of significant internal trauma. As a medical team sprang into action, Sarah found herself working alongside Marcus with the seamless coordination they'd developed over the past few weeks. The patient, Emma, was 17 years old and had been driving alone when she'd swerved to avoid a deer and hit a large oak tree. Her vital signs were unstable, and Sarah could see the telltale signs of internal bleeding that required immediate intervention. As Marcus began his assessment, Sarah anticipated his needs with the kind of intuitive teamwork that reminded her of working with her combat medic partner during her second deployment. "Sarah, I need you to establish a second four-line while I check for abdominal trauma," Marcus said, his voice taking on the authoritative tone she recognized from high-pressure situations. "And prep a chest tube kit. Her breathing sounds suggest possible pneumothorax." As they worked together, Sarah felt the familiar surge of adrenaline that came with life-or-death medical situations. Her military training took over completely, and she moved with the practiced efficiency she'd learned in field hospitals where seconds mattered and hesitation could mean the difference between life and death. Emma's condition was deteriorating rapidly, and Sarah could see that they needed to make critical decisions quickly. When the girl's blood pressure dropped suddenly, Sarah immediately began calculating medication dosages and preparing emergency interventions without waiting for instructions. "She's going into shock," Sarah announced, her voice carrying the confident authority she'd used when reporting to field commanders. "Blood pressure is dropping, heart rate is climbing, and her skin is becoming cold and clammy. We need to get fluids running and consider blood products." Marcus looked at her with surprise, not because of her clinical assessment, which was entirely accurate, but because of the transformation in her demeanor. The quiet, reserved nurse he'd been working with had suddenly become a commanding presence who took charge of the situation with the kind of natural authority that only came from extensive experience with trauma medicine. "Get me O-negative blood from the emergency supply," Sarah continued, addressing the other nurses with the same decisive tone. "And call the trauma center. We're going to need immediate surgical consultation." As they stabilized Emma and prepared her for transport, Sarah realized that she had completely dropped her civilian persona. She'd used military communication protocols, demonstrated advanced trauma assessment skills, and taken charge of the situation in a way that revealed years of specialized training. The other staff members were following her lead without question, responding to the confidence and expertise she projected when she stopped trying to hide her capabilities. After Emma was successfully transferred to the trauma center, Sarah found herself alone with Marcus in the treatment room, the adrenaline slowly fading as they cleaned up and restocked supplies. She could feel his eyes on her, and she knew that her behavior during the emergency had answered any remaining questions he might have had about her background. "That was exceptional work," Marcus said quietly, his voice carrying a weight of understanding that made Sarah's chest tighten with anxiety. "Your response time, your assessment skills, the way you took command of the situation, that's not something you learn in civilian nursing programs." Sarah continued cleaning the treatment table, avoiding eye contact. "I told you I've had additional emergency training," she said, but her voice lacked conviction. "Sarah," Marcus said gently, "I've worked with Army medics before. I know the difference between additional training and combat experience." The words hung in the air between them, and Sarah felt the careful wall she'd built around her military service beginning to crumble. She could continue denying the obvious, but Marcus had seen enough to know exactly what kind of experience had shaped her medical skills. "I'm not ready to talk about it," she repeated, using the same words she'd said weeks earlier, but this time her voice carried less certainty. Marcus nodded and moved to help her with the cleanup, working in companionable silence. After a few minutes, he spoke again, his voice careful and non-confrontational. When I first got out of the Navy, I tried to pretend that my SEAL experience didn't matter anymore. I thought if I could just learn civilian protocols and fit into a normal hospital environment, I could leave all that military stuff behind me. Sarah glanced at him, curious despite herself. "But I discovered that trying to hide such a fundamental part of who I am was exhausting," Marcus continued. "And it wasn't fair to my patients, either. The skills I learned in combat, the ability to stay calm under pressure, to make quick decisions, to work efficiently in chaotic situations, those are valuable assets in civilian medicine, not liabilities to be ashamed of." "It's not shame," Sarah said quietly, finally looking at him. "It's just complicated." Marcus set down the supplies he'd been organizing and gave her his full attention. "I imagine it is. Everyone's experience is different, and everyone processes their service differently. But working alongside you these past few weeks, seeing how naturally you handle emergency situations, how you anticipate needs and respond to crises, it's clear that you have exceptional skills that come from exceptional training." Sarah felt a familiar tightness in her throat, the same emotion that surfaced whenever she thought too deeply about her time in Afghanistan. "The training came at a cost," she said, her voice barely audible. "It usually does," Marcus replied simply. "That's why it's so important to find people who understand what that cost was." Before Sarah could respond, Dr. Walsh appeared in the doorway, her face bright with approval. "I just got word from the trauma center. Emma is going to make a full recovery. They said the rapid intervention and stabilization you provided probably saved her life." Sarah felt a mixture of satisfaction and discomfort at the praise. She was glad that Emma would recover, but the recognition of her skills felt dangerous. Too much attention could lead to questions she wasn't prepared to answer. Sarah's response was textbook emergency medicine, Marcus said, drawing Dr. Walsh's attention to him. She demonstrated exactly the kind of advanced trauma care we were discussing earlier. Dr. Walsh looked at Sarah with new interest. "I have to say, I'm impressed. Have you considered advanced certification in emergency nursing? With skills like yours, you could be leading our trauma response team." The suggestion made Sarah's stomach clench with anxiety. More responsibility meant more visibility, and more visibility meant a greater chance that someone would start asking detailed questions about her background. She chose a night shift nursing specifically because it allowed her to help people without drawing the kind of attention that could unravel the quiet life she'd built. "I appreciate the confidence," Sarah said carefully, "but I'm comfortable with my current role." Dr. Walsh seemed surprised by her response, but before she could push further, another patient arrived, and the conversation shifted to immediate medical needs. As they returned to work, Sarah was acutely aware that the evening's events had changed something fundamental in her relationship with her colleagues, and particularly with Marcus. Over the remaining hours of their shift, Sarah found herself thinking about Marcus's words about the value of military medical experience in civilian settings. She'd spent so much energy trying to downplay her capabilities that she'd never considered the possibility that her background might be seen as an asset rather than something to hide. But the idea of being more open about her military service still filled her with dread. Her combat experiences weren't just professional training. They were bound up with memories of loss, trauma, and moral complexities that she'd spent years learning to manage. The thought of those experiences becoming part of casual workplace conversation felt overwhelming. As they finished their shift and prepared to leave, Marcus approached her with a thoughtful expression. "Sarah, I hope you know that anything you choose to share with me stays between us. I'm not trying to push you to talk about things you're not ready to discuss." She looked at him, seeing genuine respect and understanding in his eyes. "I know," she said, "and I appreciate that. It's just, when you've spent years learning to keep certain things separate, it's hard to imagine bringing them together again." "I understand," Marcus said. "But if you ever want to talk to someone who won't judge you for having those experiences, someone who knows that serving in combat doesn't make you broken or different in a bad way, I'm here." As Sarah drove home through the quiet Seattle streets, she found herself thinking about Emma and how natural it had felt to take charge of her care. For those crucial minutes, she hadn't been pretending to be someone else or carefully monitoring her responses to seem more civilian. She'd been fully herself, competent, decisive, and unafraid to use every skill she possessed to save a life. The experience had been both exhilarating and terrifying. It reminded her of why she'd been drawn to combat medicine in the first place. The profound satisfaction of using her abilities to make a real difference in life or death situations. But it also highlighted how much of herself she'd been suppressing in her effort to fit into civilian life. When she reached her apartment, Sarah found herself looking at a framed photo she kept on her nightstand, a picture of her medical unit from her second deployment in Afghanistan. She kept it hidden in a drawer for months after returning home, unable to bear the memories it triggered. But eventually, she'd realized that pretending those relationships and experiences had never existed was somehow more painful than acknowledging them. For the first time in years, she allowed herself to really look at the faces in the photo, her fellow medics, the soldiers they'd served with, the commanding officers who had trusted her with life and death responsibilities. She'd been proud of her service then, proud of her skills, and her ability to perform under pressure. Somewhere along the way, she'd started treating that pride like a liability instead of an asset. Tonight had shown her that maybe it was time to consider a different approach, one that didn't require her to hide such a fundamental part of who she was. The following Tuesday, Sarah arrived at work to find the clinic buzzing with unusual activity. Dr. Walsh had called a staff meeting to discuss the implementation of a new emergency response protocol, and Sarah could see that Marcus was already in the conference room, setting up presentation materials. As she gathered with her colleagues, she felt a familiar knot of anxiety in her stomach. Staff meetings often led to changes that could disrupt the carefully balanced routine she'd established. "As you all know," Dr. Walsh began, "we've been seeing an increase in serious trauma cases over the past few months. After consulting with Dr. Rodriguez, we've developed a comprehensive emergency response protocol that will better serve our community's needs." Marcus stood and began outlining the new procedures, explaining how the clinic would expand its trauma capabilities and implement more systematic approaches to emergency care. As he spoke, Sarah recognized many of the protocols he was describing. They were based on military medical procedures adapted for civilian use. The key to effective trauma response, Marcus explained to the assembled staff, is having team members who can maintain clear communication and decisive action under pressure. We'll be implementing a training program to develop these skills, but we also want to identify staff members who already demonstrate advanced capabilities in emergency situations. Sarah felt her pulse quicken as she realized where this presentation was heading. Dr. Walsh was looking directly at her when Marcus mentioned identifying existing advanced capabilities. "Which brings me to an exciting development," Dr. Walsh continued. "Based on recent performance evaluations and observe emergency responses, we're creating a new position for an emergency response coordinator. This person would lead our trauma team, oversee protocol implementation, and provide advanced care for our most critical cases." The room fell silent as staff members absorbed this information. Sarah could feel several of her colleagues glancing at her. Her exceptional performance during Emma's treatment had been noticed by more people than she'd realized. "Sarah," Dr. Walsh said, turning to face her directly, "we'd like to offer you this position. Your demonstrated skills in emergency situations, your ability to remain calm under pressure, and your natural leadership during crisis situations make you the ideal candidate." The offer hung in the air, and Sarah felt the weight of every gaze in the room. This was exactly the kind of attention and responsibility she'd been trying to avoid, a role that would place her at the center of every major emergency, making it impossible to maintain the low profile she'd carefully cultivated. "I'm very honored by the offer," Sarah managed, her voice steady despite the turmoil she felt inside. "But I need some time to consider it." Dr. Walsh smiled understandingly. "Of course. Take all the time you need. We're not looking to implement these changes immediately. There would be additional training, certification requirements, and a gradual transition period." As the meeting concluded and staff members dispersed to begin their shifts, Sarah found herself alone with Marcus, who was packing up his presentation materials. She could sense that he understood her internal struggle, even though they'd never directly discussed her reluctance to take on more visible roles. "That's a significant opportunity," Marcus said quietly, not looking up from his papers. "Emergency response coordinator would put you in a position to really make a difference in people's lives." "It would also put me under a microscope," Sarah replied, unable to keep the anxiety out of her voice. "More responsibility means more scrutiny, and more scrutiny means questions I'm not ready to answer." Marcus finally looked at her, his expression thoughtful. "What kind of questions are you afraid of?" Sarah hesitated, then decided to be more direct than she'd ever been before. "Questions about where I learned advanced trauma protocols. Questions about why my emergency response skills are so well developed. Questions about what kind of training produces the instincts I demonstrated with Emma. And you think those questions will be problematic because the answers involve experiences I'm not ready to discuss with people who wouldn't understand what they meant," Sarah said, her voice gaining strength as she finally articulated fear she'd been carrying for years. Marcus set down his materials and gave her his full attention. "Can I tell you something about my transition to civilian medicine? When I first started working in hospitals, I was terrified that people would find out about my military background. Not because I was ashamed of my service, but because I was afraid they wouldn't understand that being a combat medic had made me better at saving lives, not worse." Sarah listened intently, recognizing her own fears in his words. "I thought if people knew I'd treated battlefield injuries, they'd assume I was damaged or unstable or somehow unsuited for civilian patient care," Marcus continued. "So I try to hide the very experiences that had given me my most valuable skills." "What changed your mind?" Sarah asked. "A situation a lot like what happened with Emma," Marcus replied. "There was a mass casualty incident at a construction site. Multiple victims, chaos, inadequate resources. I found myself taking charge because my combat experience had taught me how to organize medical response in impossible circumstances." He paused, seeming to consider his words carefully. "Afterwards, the hospital administrator asked me where I'd learned to manage that kind of crisis so effectively. I could have deflected or given some vague answer about emergency training, but instead I told him about my time as a Navy SEAL medic." "How did he react?" "He offered me a promotion," Marcus said with a slight smile. "He said that kind of experience under pressure was exactly what they needed in their emergency department. It was the first time I realized that my military background could be an asset in civilian medicine rather than something to hide." Sarah felt a familiar tightness in her chest. "But what about the other stuff? The parts that aren't just medical training? What about the reasons why someone serves in combat zones in the first place?" Marcus's expression grew more serious. "You mean the trauma? The moral complexity? The things that happen in war that civilian medical staff wouldn't understand?" "All of it," Sarah said quietly. "The whole package that comes with military medical service." "That's the hard part," Marcus admitted. "And I won't pretend that sharing your military experience automatically makes all of those complexities go away. But I've found that being honest about my background, at least the professional parts, actually makes it easier to manage the personal parts." Before Sarah could respond, an emergency alarm sounded, signaling an incoming ambulance. As they rushed to the receiving area, Sarah pushed their conversation to the back of her mind and focused on the immediate medical crisis at hand. The paramedics brought in 2 victims from a workplace accident. A forklift had malfunctioned at a warehouse, pinning one worker and seriously injuring another who had tried to help. The first victim, Roberto, had suffered severe crush injuries to his legs, while the second, Mike, had multiple lacerations and possible internal trauma from debris. As the medical team mobilized, Sarah felt the familiar surge of focus that came with serious emergency situations. She automatically began coordinating care for both patients, assigning tasks to other staff members, and prioritizing interventions based on the rapid assessment protocols she'd learned in combat zones. Roberto needs immediate surgical consultation for his leg injuries, Sarah announced, her voice carrying the authority that emerged during crisis situations. Mike, I need a full trauma workup, chest X-ray, abdominal CT, and continuous monitoring for signs of internal bleeding. Marcus was treating Roberto's crush injuries while Sarah managed Mike's care, but she could sense him observing her leadership approach. She moved between patients with efficient precision, making clinical decisions quickly and communicating with the kind of clear, direct language that kept everyone focused on priorities. When Mike's condition suddenly deteriorated, showing signs of internal hemorrhaging, Sarah's response was immediate and decisive. She called for emergency blood products, prepared for possible surgical intervention, and coordinated with the trauma center for immediate transfer, all while maintaining the calm, controlled demeanor that prevented panic among the staff. Pressures dropping and heart rates climbing, Sarah reported, her hands already working to establish additional fore access. We're looking at significant internal bleeding. Mike, I need you to stay awake and talk to me while we get you ready for surgery. As they stabilized both patients for transport, Sarah realized that she had once again taken charge of a complex emergency situation with the kind of natural authority that revealed extensive trauma experience. The other nurses had followed her lead without question, responding to her decisive leadership in a way that suggested they recognized and trusted her expertise. After both patients were successfully transferred to the trauma center, the emergency department returned to its normal rhythm. Sarah was restocking supplies when Dr. Walsh approached her, accompanied by Dr. Martinez, the clinic's medical director, whom Sarah had met only briefly during her initial hiring process. "Sarah, that was outstanding work," Dr. Walsh said, her voice carrying genuine admiration. "The way you coordinated care for multiple trauma patients simultaneously, it was exactly the kind of advanced emergency response we're hoping to implement clinic-wide." Dr. Martinez nodded in agreement. "Your ability to maintain clear thinking and effective communication under extreme pressure is remarkable. That kind of skill set usually requires specialized training and extensive experience with critical situations." Sarah felt the familiar anxiety rising as the conversation moved toward questions about her background and training. She could sense both administrators trying to understand how a night shift nurse had developed such advanced emergency response capabilities. "I've always been comfortable in crisis situations," Sarah said, using her standard deflection, but she could tell that her vague explanation wasn't sufficient for the level of skill she'd demonstrated. Dr. Martinez studied her with the keen interest of someone trying to solve a puzzle. "Your communication style during emergencies, the way you assign tasks and prioritize interventions, it's very systematic and decisive. That kind of approach usually indicates formal training in emergency command protocols." Before Sarah could respond, Marcus appeared at her side. "Dr. Martinez, I think Sarah would be an excellent candidate for the emergency response coordinator position we discussed. Her instincts and capabilities are exactly what we need for effective trauma care." Sarah shot him a grateful look for redirecting the conversation away from questions about her background. But she could see that both administrators remained curious about the source of her exceptional skills. "We'd definitely like to move forward with offering you the position," Dr. Walsh said to Sarah. "The salary increase would be substantial, and you'd have the opportunity to really shape how we handle emergency medicine in our community." As the administrators returned to their offices, Sarah found herself alone with Marcus again. She could see in his expression that he understood her internal conflict. The opportunity was appealing, but accepting it would mean stepping into a role that would make it impossible to maintain her carefully constructed civilian persona. You realize that if I take that position, people are going to ask a lot more questions about where I learned to do what I do, Sarah said quietly. Yes, Marcus replied. And you realize that continuing to hide your capabilities means limiting your ability to help people who need exactly the kind of skills you possess. Sarah felt the weight of the choice before her. For 3 years, she'd found safety and stability in remaining invisible, in using just enough of her abilities to do her job well without drawing attention to the full extent of her capabilities. But tonight had shown her once again how natural it felt to take charge of emergency situations, how satisfying it was to use all of her skills without reservation. I'm scared, she admitted, the words feeling strange after years of projecting competence and self-sufficiency. That's understandable, Marcus said gently. But maybe it's time to consider whether hiding from your abilities is actually protecting you, or whether it's preventing you from becoming who you're meant to be. As Sarah prepared to leave at the end of her shift, she found herself thinking about Roberto and Mike, both of whom were expected to make full recoveries because of the rapid, coordinated response they'd received. She thought about Emma from the previous week, whose life had been saved by quick thinking and decisive action. For the first time in years, Sarah began to seriously consider the possibility that her military experience, including all of its complexity and trauma, might be something to embrace rather than hide. The question was whether she had the courage to find out. Sarah had requested a week off to consider the emergency response coordinator position, but instead of using the time to relax, she found herself wrestling with memories and emotions she'd spent years trying to keep buried. She walked the Seattle waterfront each morning, trying to sort through the conflicting feelings that Marcus's words and Dr. Walsh's offer had stirred up. On Thursday afternoon, she made a decision that surprised even herself. She drove to the VA hospital across town, where Marcus worked during his regular shifts. She'd never visited a VA facility since her discharge, having deliberately sought all of her medical care through civilian providers to avoid triggering memories of her military service. The hospital lobby felt familiar in a way that made her chest tight with emotion. Veterans of various ages and eras moved through the space with the same purposeful but weary demeanor she remembered from her own early days of readjustment. She asked at the information desk for Dr. Rodriguez and was directed to the emergency department. Marcus looked genuinely surprised to see her when she appeared at the nurse's station, but his expression quickly shifted to concern. "Sarah, is everything okay? I was wondering if we could talk," she said, suddenly, feeling uncertain about her decision to come. "When you have a break." "Of course," Marcus replied. "Give me about 20 minutes to finish up with my current patients, and then we can grab coffee in the cafeteria." As Sarah waited, she found herself observing the VA emergency department with professional interest. The medical staff moved with the same efficiency she'd seen at the community clinic, but there was something different about the way they interacted with patients, a kind of understanding and patience that came from shared experience. When Marcus joined her in the cafeteria, he carried 2 cups of coffee and settled across from her at a quiet table near the windows. "I have to admit, I'm surprised to see you here," he said gently. "VA hospitals aren't easy places for veterans who are still processing their service experiences." "That's actually why I came," Sarah said, accepting the coffee gratefully. "I realized that I've been so focused on avoiding reminders of my military service that I've never really dealt with what it meant to me." Marcus nodded, his expression encouraging her to continue. "When you talked about embracing your background instead of hiding it, I couldn't understand how that was possible," Sarah continued. "But watching you work, seeing how naturally you integrate your military experience with your civilian career, it made me wonder what I might be missing by trying to keep everything separate. What kind of things have you been avoiding?" Marcus asked. Sarah took a deep breath, preparing to share more about herself than she had with anyone since leaving the Army. "I served 2 tours in Afghanistan as a combat medic with the 75th Ranger Regiment. I treated battlefield injuries, worked in forward operating bases, and saw things that most people in civilian medicine never have to deal with." Marcus listened without interruption, his expression serious but not judgmental. I was good at my job, Sarah continued, her voice gaining strength. Really good. I could work under fire, make life-or-death decisions quickly, and handle trauma that would overwhelm most people. But when I came back, I convinced myself that those skills came with too much baggage to be useful in civilian life. What kind of baggage? Marcus asked gently. Sarah stared out the window at the Seattle skyline, gathering courage to articulate thoughts she'd never spoken aloud. The things I saw, the soldiers I couldn't save, the moral complexity of providing medical care in a war zone where the lines between right and wrong aren't always clear. She paused, then looked back at Marcus. And the guilt of being good at something that was part of a larger system I came to have complicated feelings about. Marcus nodded slowly. That's the hardest part of military medical service. Learning to separate your professional pride in saving lives from your personal feelings about the circumstances that put those lives at risk. Exactly, Sarah said, feeling a profound relief at being understood. So when I got out, I thought the safest approach was to just use the technical skills and leave all the emotional complexity behind. But that's not really possible, is it? Marcus asked. The skills and the experiences are interconnected. Trying to separate them is like trying to use only half of who you are. Sarah felt tears prick at the corners of her eyes. The first tears she'd allowed herself to shed about her military service since her discharge. I've been so afraid that if people knew about my combat experience, they'd see me as damaged or unstable. Or they'd ask questions I wasn't ready to answer about what it was like over there. And now I'm starting to think that hiding such a fundamental part of myself has been more exhausting than dealing with people's reactions would be, Sarah said, especially after seeing how you've managed to integrate your background into your civilian career. Marcus leaned forward, his expression earnest. Sarah, I want you to understand that being open about your military service doesn't mean you have to share every detail of your combat experiences with everyone you work with. It means acknowledging that those experiences shaped you into someone with exceptional skills and capabilities. He paused, then continued. The emergency response coordinator position, it's not just about having advanced medical training. It's about having the kind of experience under pressure that allows you to lead others through chaotic situations. That's exactly what your combat service taught you. Sarah wiped away a tear that had escaped, feeling both vulnerable and oddly liberated by the conversation. What if I'm not ready to talk about the details? What if people ask questions about specific experiences I had overseas? Then you tell them that you're not ready to discuss those details, but that you're proud of your service and the skills it gave you, Marcus said simply. Most people won't push beyond that, and the ones that do probably aren't worth worrying about. They sat in comfortable silence for a few minutes, watching the afternoon light shift across the hospital cafeteria. Sarah found herself thinking about the soldiers she'd served with, the medical professionals who had trained her, and the countless patients whose lives had been improved by the skills she developed in combat zones. Can I ask you something? Sarah said finally. Of course. Do you ever have nightmares? Or moments when civilian medical situations trigger memories of treating combat casualties? Marcus's expression grew serious. Yes, not as often as I used to, but it still happens. The smell of certain antiseptics, the sound of helicopter rotors, the feeling of working on someone who's bleeding out. Sometimes it takes me right back to field hospitals in Iraq. How do you handle it? Therapy mostly. And talking to other veterans who understand what those experiences were like, Marcus said. It also helps to remember that those difficult experiences gave me capabilities that allow me to save lives in ways that other medical professionals can't. Sarah nodded, feeling a piece of understanding click into place. So you don't see your combat experience as something that happened to you. You see it as something that made you who you are. That's exactly right, Marcus said. And the person it made me is someone who can stay calm in chaotic situations, make critical decisions under pressure, and work effectively with limited resources. Those are valuable traits in any medical setting. As their conversation wound down, Sarah felt a clarity about her situation that she hadn't experienced in years. The emergency response coordinator position wasn't just a career opportunity. It was a chance to fully embrace the capabilities that her military service had given her. "I think I'm ready to accept the position," she said, the words feeling both scary and liberating. Marcus smiled. "I think you'll be excellent at it. And if you ever need someone to talk to about balancing military experience with civilian medical practice, you know where to find me." That evening, Sarah called Dr. Walsh and formally accepted the emergency response coordinator position. As she hung up the phone, she felt a mixture of excitement and nervous anticipation about the changes ahead. Over the following weeks, as she began transitioning into her new role, Sarah discovered that Marcus had been right about people's reactions to her military background. When she mentioned during staff meetings that her emergency response training came from her service as an Army combat medic, her colleagues responded with respect and interest rather than the judgment or prying questions she'd feared. Dr. Walsh was particularly pleased to learn about Sarah's military medical background, seeing it as validation of her decision to create the emergency response coordinator position. "No wonder you're so skilled at managing crisis situations," she said. "That kind of training and experience is exactly what we need." The new role challenged Sarah in ways that felt both familiar and fresh. She developed training protocols for the nursing staff, coordinated with local hospitals to improve patient transfer procedures, and led the response team for major emergencies that came through the clinic. Each crisis situation allowed her to use more of her capabilities, and she found herself feeling more professionally fulfilled than she had since leaving the Army. 3 months in her new position, Sarah was leading a response to a serious car accident when she realized how much her perspective had changed. As she coordinated care for multiple trauma victims, using the systematic approach and clear communication style she'd learned in combat zones, she felt proud of her capabilities rather than anxious about revealing them. Marcus, who was working alongside her, caught her eye during a brief lull in the crisis. "You look like someone who's found where she belongs," he said quietly. Sarah smiled, her hands steady as she prepared medications for the next patient. "I think I'm starting to understand the difference between hiding from your past and building on it." As the last patient was stabilized and transferred to the trauma center, Sarah found herself thinking about the photo of her combat medical unit that she'd moved from her nightstand to her office at the clinic. She'd also started attending veteran support groups and had begun talking to therapists who specialized in military transition issues. The nightmares hadn't completely disappeared, and she still had moments when civilian medical situations triggered difficult memories from her deployments. But she was learning to see those challenges as part of a larger story that included exceptional training, meaningful service, and capabilities that allowed her to make a real difference in people's lives. 6 months after accepting the emergency response coordinator position, Sarah received a letter from Emma's family, the teenage accident victim who had been one of the first patients she treated while working alongside Marcus. Emma had made a complete recovery and was planning to study medicine in college, inspired by the medical professionals who had saved her life. As Sarah read the letter, she thought about all the patients she'd been able to help because she'd finally stopped trying to hide her capabilities. The skills that had once felt like dangerous secrets had become the foundation of a career that allowed her to use every part of her training and experience. That night, as she walked home through the Seattle streets, Sarah reflected on the journey that had brought her from the wounded silence of her early civilian years to the confident competence of her current role. She'd learned that healing didn't mean forgetting or hiding from her military experiences. It meant finding ways to honor them while building a future that made the best use of everything she'd learned. Marcus had been right about the importance of not hiding such fundamental parts of oneself. But more than that, he'd shown her that acknowledging her combat experience didn't mean defining herself solely by its trauma. She was a veteran, a healer, a leader, and a person who had found a way to transform difficult experiences into capabilities that served others. For the first time since leaving the Army, Sarah felt whole, not because she'd left her military service behind, but because she'd finally found a way to carry it forward with pride.